What does your autonomic nervous system dysregulation have to do with chronic pain and mysterious persistent health issues? Turns out a lot. So if you're interested in that, this is going to be important information for you. My name is Rochelle Walsh. I'm a complex trauma therapist, have been for decades, and have a program where I help women go from overwhelmed to calm and confident. So autonomic nervous system, what are we talking about? What we're talking about is the nervous system and the threat detection center of the brain. So we might, in layman's terms, say if someone has a dysregulated autonomic nervous system, they're going to be dealing with anxiety, or they're going to be dealing with, a chronic fight or flight response. And here's where it gets tricky. A lot of people might all of a sudden start having a lot of health issues or chronic pain. And when I talk to them, they might say, I've been to XYZ, I've been to many naturopaths, and I've done supplements, and I've done, I'm doing yoga, or I'm exercising, and I'm taking supplements, and I get massages, and I go to chiropractic care, and I try to do all these things to relieve stress from my body. And I've done cellular detoxes, I've done all the things that people tell me I need to do to fix my health, but they might say things like I have gut disturbance, I have GI issues, or I have toxicity or a lot of food sensitivity, and nothing has gotten to the root of it. Migraines, fibromyalgia, all those things, right? So, and generally when people come in with that, they know that all of those things, autoimmunity, thyroid issues, hormonal disruption, that a lot of it points back to inflammation. And that's not new information to them, it's just inflammation. What is frustrating to them is that they have been doing all these things to help their body and nothing's working. And so I want to explain that today because it's super important. I feel so passionate about this. And again, if you've done all those health things, my husband practices functional medicine, and I have a great respect for people doing things we've been on many health journeys within our family. And so I'm not at all knocking getting help for physical health, but I'm going to say this. Here's the thing. So if we know that inflammation is the root of chronic illness, chronic pain, autoimmunity, and those sorts of things, if you know that, if you don't know that, you need to know that. And now we have to say, but what caused the inflammation? Because not everybody that worked in that building got mold toxicity. Why did you? Not everybody who does a certain activity ends up in bed afterwards. Why are you? And so then someone say, well, it's genetic differences. I would agree. My husband does, epigenetic testing. But what activates those symptoms, those genetic predispositions? What activates that genetic expression? Why is that dis-ease happening? Why is that inflammation happening? And the number one predictor of a stress response is not the food, not the environment. The number one predictor of an overactivated stress response has to do with emotional regulation. This is according to a Harvard study, right? So if that's the number one predictor for stress response, which is fight or flight equals inflammation, inflammation equals disease. So many people go down here and they're treating the disease, they're treating the symptoms. Meanwhile, they are not treating the emotional and the subconscious core beliefs that actually start the stress response. So they treat this issue, the stress response, the body attacks itself in another way, they treat that symptom, and it's a rabbit hole. So let me explain something to you. And here's the biggest thing. I think a lot of these women come and they'll say, but I've never had anxiety. I'm the one who's always been so strong. I've always been so resilient. I'm the one who encourages everyone else. I'm the one who takes care of everything. I don't understand why this is happening to me. I've had people say that they were going along just fine, and all of a sudden something happened, something emotional, some life experience, and then all of a sudden they're kind of like their body takes them out. They're sidelined. And why this is because they don't recognize that high level of performing and pleasing and overachieving and overgiving and just being in this high performance mode. They've never considered that that's anxiety. They've never considered that while they're going, that their body is actually in fight or flight because it's normal for them. So there is a subconscious driver that keeps them in that state. But I do hear them say things like this. Even when I have time to relax, I can't shut my mind off. If I could just shut my mind off, and now it's getting foggy because it's constantly going, right? Or they tend to do activities that, they're trying to relieve stress from their body, like through exercise and things, but it just keeps going. What's really important to understand is if you're not addressing the underlying subconscious and your body is still firing that stress response, and a lot of this has to do with emotions, right? That maybe they've never learned to be really attuned and have a lot of inner compassion. So instead of inner compassion, they have inner criticism. And so that pressure continues. Their body continues to hold the emotions while they're performing, and it gets heavier and heavier and heavier, and they get mounting inflammation, and then they get sick. And so if you have been combating health issues and you're not getting relief, and it's not like, you start doing the new thing and then you're feeling better and you're on your way, then you probably wouldn't be listening to this. But if that's the case, you shouldn't be without hope, but you should ask yourself, have I really gotten to the root of this? And that does not mean that you need to go back into the past and dig up all the past events and go into your childhood. It does mean that you are going to need an approach that changes that subconscious, because there might be like, it's not okay to relax. It's not okay to feel my feelings. It's not okay to express myself. It's not, if I relax, everything will fall apart. It's not okay to say no to someone. It's not okay to make mistakes. I have to be perfect. So there's a lot of those underlying subconscious core beliefs that are driving that stress response act of being able to feel and move through emotions safely. And when you can do that, when you can move through emotions safely, then you are able to not fret, because you know that whatever comes up tomorrow, you're going to be able to handle it. And God is going to be there in tomorrow. But this is not a lack of faith. This is in the autonomic nervous system. This is not about how much your smart brain knows. It's not even about indicating that you lack faith or that you don't know these things. It's about really those subconscious core programs. So if you're frustrated with health issues, and addressing the physical health issues isn't getting to the bottom of it, not resolving it, it's probably because you haven't gotten to the root of it. So listen to this for more information, but just know that healing is possible. I never make health-related promises, but we see migraines and long-standing food sensitivities and body weakness and body pain and all the things resolve so much faster with only dealing with this. We're not even addressing the physical health issues. So once you get to the root of the emotional issues, you're going to feel a whole lot better, and you're going to have energy to do all the things that you want to do in life rather than spending your time combating physical illness. So hope this is helpful. Subscribe to my channel for more information and videos like this, and I'll see you in the next one.